Do your kids get ear infections? I'm Dr. Gigi, and this is your 1% Better tip of the day. So in the office, we see all the time ear infections. Actually, 5 out of 6 kids are gonna have an ear infection at some point. And so it's very common, especially now going into the summer. We're gonna have more kids in the pool, which also can cause more ear infections. So why does this happen? It actually is due to the anatomy of the ear, because inside our ear we have these little tubes that drain our ear, and they go right in the back of our mouth, exactly where the adenoids and the tonsils are. And that tube is called the eustachian tube. And the tube is the inside of it is very similar to the inside of the nose. So whenever, like, if you get a cold, you notice you get more mucus and that area gets all inflamed. That's what happens in the ear too. So when it's not draining properly and it gets infected, then it starts producing that mucus and it gets irritated and inflamed in there. And the big thing for kids is their eustachian tube, that tube is more horizontal instead of having that downward incline, which changes as we grow, and then we get that downward incline. So it can get very hard to drain out. So when we have the ear infection, now what do? Actually, even if you didn't do anything at all, it does go away within about 2 weeks, the studies have shown. But to make it go away even faster, there's a better solution than going to antibiotics. What we do here in the office is, first of all, adjust. Adjusting helps so much in both boosting the immune system so that the body can fight the infection, but also it helps drain the ear and helps make that area where the tube is, to make it less tense, because a lot of times if those muscles that are around the ear are very tight, they can make it even harder for it to drain. So by getting that first bone adjusted, the atlas bone, that will help tremendously with the draining of the ear and with the overall with your body being able to fight that infection. The second thing that you can do is using colloidal silver drops in the ear, and you can do that multiple times a day, or you can use garlic drops. Either one, colloidal drops, we've had really good results with that, and it's an antibacterial, natural antibacterial, which will help clean out the ear. Also, doing things like yawning and chewing actually help with draining the tube as well, so you can do that. But overall, just going to a practitioner that can help you out and make sure that they're monitoring, because sometimes we might need to go to that next step and we might need to refer out. But most of the time it is very manageable without antibiotics, without ruining the gut flora, so we can do that naturally. So try out those steps there and let me know how that works out for you.